there's a lot that goes into getting the medical treatment that you need. Knowing the doctors to go to. Sometimes people will go to a doctor that may be a family doctor, and that's fine, except that family doctors may be more versed in colds and flus and sore throats and things like that. The problem is that they may write you a prescription and say, come back in 30 days. Well, the problem is 30 days later, you've covered up the symptoms, you haven't gotten any physical therapy or any real treatment to get better. So you're likely to be worse, and then adjusters will often tap into that and they'll try to argue, hey, you weren't really hurt. You waited 30 days before you followed up with anybody and you just went to a family doctor. So knowing the doctors to go to and knowing the treatment plan that is going to make the most sense. I always leave the treatment plan up to the doctor and the patient. But I've done this for 18 years, so I know that if you go to a doctor, a chiropractor, for 10 months and you don't get better, that's a problem. What defense attorneys are going to do is they're going to argue, hey, why should we have to pay for 10 months of treatment that didn't help? Why did you keep going after 2 months and 3 months and 4 months? That's a really good argument, and it makes it harder for me. It's much better if someone goes and gets conservative care first, tries that. If you're better, great, we stop it right there, we send a demand and we get you fully compensated for that soft tissue case. But if you're not better, instead of continuing conservative care that's not working, the better approach is to then go to a specialist, an orthopedic, a neurologist, a physiatrist, pain management specialist, get injections or pain management treatment that's beyond that initial conservative care. If that doesn't work, well, if that works, then we settle the case there, we send the demands, and we settle it for the right amount, or we litigate. If you aren't better there, then that doctor, if needed, will refer you to a surgeon. If you haven't gotten better with conservative care, and you haven't gotten better with pain management, then surgery is the next logical step, at least for an evaluation. Then you can decide after you talk to the doctor whether you want to have the surgery if it's recommended, or if you don't. If you want to have it, then we're going to send the demand based on all of that treatment, including the surgery. If you don't want to have it, we're still going to get the projected medical treatment and cost projections so that we can include that future medical expense in your demand to get you compensated for the surgery that you may need in the years to come.